This presentation is going to look at what actually do we mean when we're saying advanced practice nurse, and how has this role been developed and changed over time? So when we think about it, it has really started a long time ago. We had the development of specialty areas in hospitals, and this led to the need to have registered nurses with their extended or advanced practice roles. You may have worked in with specialist wound nurses, emergency, where often they have specialty nurses. There may be specialty pediatric nurses. So it has been a role that's been evolving over time. The term advanced practice nurse really only sort of started in 1980, and then we had our certificate of recognition in 1990. But now there are actually nurse-led clinics. There's a range of roles and across acute and even in non-acute areas. So in residential aged care, they often have advanced practitioners who can, actually have a scope of practice for basic medications and sort of prescribing. So this is something that's really been evolved over time. Internationally, Australia is a little bit behind the times. Advanced practice nurses were developed strongly in America first and then in Europe. And Australia has now sort of really kept up with that. But it's been the development of these advanced practitioners has been to fill the gap so that is particularly in America, there just wasn't enough doctors to see the number of patients. And so the role of the nurse navigator or the nurse practitioner was developed as a sort of a cost-effective way to see patients. And this has led to a whole restructure in healthcare systems. And we're finding that in Australia now. And often nurse-led clinics is a way to actually have more patients seen and a basic care. The prescribing can be done by the role of the nurse in these health-led, nurse-led clinics. And then with harder cases, then they can call in the doctor. But it enables a lot of patients to be seen cost effectively. Um, However, one of the things there's been consistently inconsistent names for this role, and this is still today. And this has led to confusion often with different healthcare professionals, but also with the healthcare consumers. And so when we look at sort of the two main names, you've got the advanced practice nurse, who is actually a level of practice. These are often specific to the clinical area, given a role and scope of practice often within that health professional area. But they may not have prescribing rights and they haven't got a particular master's and they're not endorsed as a nurse practitioner. A nurse practitioner is an advanced practice nurse who has actually been endorsed. They've completed a Master of Advanced Practice to be a nurse practitioner. And these do have specific prescribing rights out of the scope of the actual health system. So these nurses can work in emergency, in a small hospital. They may also work in private practice. And so this is the difference between your advanced nursing practice and advanced practitioners working in that scope of area and nurse practitioners who are an actual standalone practitioner. Even within Australia, we've got multiple roles and titles for our advanced practice nurses. And you'll see this in your clinical areas, and often they're specific to that actual hospital or area. But the main thing is to think about what has led them to have this role. Often it'll be postgraduate education and an expertise and experience within that clinical area. What I want you to think about is what are the challenges and advantages of having the multiple roles for an advanced practitioner nurse? And so we can sort of maybe discuss this on Teams and we talk about sort of challenges that health consumers get confused, but advantages is that they can actually be quite specific to the clinical area that they're working in. And what are the different competency standards required for these different roles? And you'll find that'll be quite different across different health service areas. So just in summary, this is really what is assessment one's all about, to explore the development of the advanced practitioner and to understand what this means for your particular area and has this role evolved. So why was there a need? And this is often because cost effectiveness to enable more patients to be seen, reduce waiting time. So there's often specific needs in a clinical area that led to the development of a role for an advanced practitioner. Thank you.